giving birth to a child, or your wife is done giving birth to a child, you discover that the next thing you are going to do is to get wheelchair for the child for life. It's actually unfortunate, so disheartening. So, which is the reason we are learning about all these structural defects. I say what prompted me to start discussing about this is when you go on social media, discover that there are a lot of people having defects. Some will have issues with one eye, issues with one or both limbs, be having different issues, right? So all those things is something that we need to know them, discuss them. We need to find a solution. Let's profile solution for it. How do we prevent it? Though many of them are not preventable, many of them the causes are unknown, but we need to make an effort to see how we can be able to extend or expand our knowledge to the necessary ones we are expected to know, or the one we can know the cause and the prevention, so that we follow the necessary guideline to overcome them. All right, we've discussed a lot of them. We've discussed about that of spinal bifida and encephaly. All right, we've discussed about um, some other congenital issues, right, of that nature, and even the things that are causing them. All right, we've discussed like that of cleft lip. I've discussed about cleft palate, club foot. That is the five we have discussed. So it's actually unfortunate if you see people that are having this defect, they don't seem to be comfortable. It can tamper with their social interaction or socialization with others, in the sense that it can give them some certain personality issues like inferiority complex and so on. Right? You come to a meeting where there's a lot of stakeholders in a particular business meeting, and you discover that out of them all, only you is on wheelchair. All right, it kind of be a challenge to the person. All right, so which is the reason we need to discuss them, we need to know them, we need to point them out, we need to fish them out and know what possibly we can do so as to prevent them. The ones who have listed before now, like spinal bifida and encephaly, that of a cleft lip, cleft palate, and claw foot, we mentioned a lot of things that could cause them, which it can be as a result of genetic issues, it can be that genetic mutation, it can be as a result of family history, it can be some certain medications, it can be folate deficiency, and other things like even maternal infection, maternal diabetes, that can be the cause, which is the reason I gave many recommendations, many guidelines that are expected to take so that you see how you can prevent such a thing. All right, so today we are going to discuss quickly on few of them again, that is still under neural tube defect. All right, under congenital, sorry, under congenital defect. All right, which some are still under neural tube defect. Now, today we are going to start with developmental hip dysplasia. Developmental hip dysplasia. What is this all about? Is when the hips, all right, the hip bone of the developing fetus is not properly aligned. All right, it is displaced from the part that is expected to be, which can cause the person maybe not to walk properly after birth, or even be on wheelchair for life. And some of the things that could lead to that particular issue is when the child is in bridge position. All right, if he's in bridge position, which is to say is in this form. All right, that's what can lead to that particular, this is in horizontal form. So that's what can lead to that. And when there is compression of the abdomen, which can still go and compress the uterus, it can lead to that developmental hip dysplasia, which is to say that the hip of the baby have been displaced from where it is, that is in the proper alignment that the thing is. So it can lead to other issues, and sometimes it can be as out of pressure, right? And also it can be as out of genetic issue, right? If there's a mutation in the gene or certain medication from the mother, right, it can lead to that particular developmental hip dysplasia. So we need to know them. And if you see that it has become a common occurrence, all right, to the family, all right, is in the family history, it is actually important that the family seek what we call genetic counseling, all right, so that they will check thoroughly what possibly must have been the cause of this and fish it out and get it solved at once. All right, if it's a result of environmental influence, that can be handled accurately. So that is it. Now another thing we're going to mention, what we call polydactyly. Polydactyly as one of the defects that someone can have. All right, is one of all the defects you see on social media. What is this polydactyly? Polydactyly is an instance where someone is having extra finger. All right, someone's supposed to have 5 fingers, right, in each of the hand, and I seen extra, so like extra 2 or 1, right? It can tamper with the person's social engagement, right, with others, right? The person will be looking at, oh, how come some people can go ahead and obtain some surgical procedure which can solve the issue, but some that do not have enough money will leave it in that way. All right, and it can be a challenge to them somehow. What could be the cause of this? It could be a sort of genetic mutation, could be, in fact, it could be unknown, from unknown source. All right, it could be a sort of alcohol intake, all right, and also cigarette smoking during early pregnancy, So all those ones are the developmental issues. You never can tell when um, you are going to experience something like that, which is to say that every mom supposed to receive what we call preconception care. All right, please, if you are joining us for the first time, do want to subscribe to this channel and turn on notification for this line. So that's what we call preconception care, which is the reason we keep encouraging every woman of childbearing age, take folic acid. Very important. Just use folic acid. It will help you. All right. So counseling, all right, from healthcare provider even before you conceive, so that some certain medications that you are not expected to use, you do away with them. All right, do not smoke, do not take alcohol, do not take something that will be a problem to you or that will lead to abnormal gene mutation when you are giving birth to your child. So that is it. To overcome this polydactyly, which is extra finger, all right, it's actually important to receive a good preconception care. You follow the necessary strategy. Do not smoke, do not take alcohol. All right, sometimes all those things can be caused by things of that nature, which we need to handle it with care and sit up and do the needful thing we're expected to do. So another thing we're going to discuss again is what we call syndactyly. It's still almost the same thing with polydactyly. In syndactyly, what happens is that these two fingers you are seeing, instead of it to separate as my hand is, all right, you can be able to separate it. You discover that it become webbed. All right, you are having webbed fingers. So is either it become web or it will even tie together, right? It will develop together. It cannot separate. It will remain in this way. Some people will go for surgical procedure to correct it, while some may not have money for surgical procedure and they will stay like that with it in that way for life. So this particular deformity or defect can actually tamper with your social interaction or social well-being. All right, that is what we are saying. It may not have anything to do with your health, right? These ones were mentioned polydactyly and that of syndactyly. It may not have anything to do with your health, you are okay, but your social health and even your performance, right, your activities, your daily routine, it may be a challenge to it, which may prompt you to go and do surgical procedure. So in order to avoid it, to prevent it, you do the needful thing. Make sure receive a good genetic counseling, all right, and even preconception care. You make sure you take enough folic acid as expected. You make sure you treat any maternal infection prior to the conception. You make sure you do not take alcohol, do not smoke, live a healthier life as you are trying to conceive. Now, next we are going to mention what we call congenital limb deficiency. Congenital limb deficiency. What is this all about? When they give birth to a child, discover that the two limbs is not in existence. All right, the child do not have limb. Congenital limb deficiency. So it's actually a problem. It's a very serious problem that we all supposed to know about, and we all supposed to um, try as much as we can to prevent them. Let us see how can we to prevent it. Now, what could cause this? It could be a problem with blood supply to the fetus. For the women that are lying now in this position, there is a bigger artery that is supplying blood, all right, to that area, to the womb area and even the abdominal area. If you are lying down, it's putting a pressure on that particular artery, cutting down the supply of blood. It can be an issue. And for those that are taking carbonated drink during pregnancy, it's one of the problem also. Carbonated drink can lead to what? Lack of circulation of blood as expected. And when this happens, it can make this congenital limb deficiency to happen. All right, when someone is not having a developed limbs, all right, the limb will become small. All right, you see small limbs, or it will not even develop at all. All right, congenital limb deficiency is a problem, and we can be able to prevent this problem by doing the right thing. Take folic acid. Make sure you maintain good sleeping position. All right, do not take carbonated drink, do not smoke, do not take alcohol while you are pregnant. All those things are things of which you can do by yourself and see that you live a healthier life, guys. Let's do the needful thing. Now, the last one we're going to discuss is what we call congenital scoliosis. Congenital scoliosis. What is this? All right, is when the spinal cord of the fetus is not properly developed, all right, making the child to be in a bent position. It's almost the same thing with that of spina bifida. But in that of spina bifida, I discovered that the materials in the spinal cord will protrude. It will come out, will bulge out. All right, but in this one, it may not bulge out, but you stays like this, right, for life. The person stays like this for life. The person will be in the bent position for life. All right, if surgical procedure is not carried out to correct that issue, the person may stay like that for life. So it might interest you to know that I actually have a link to such surgeon that can grant you that sophisticated surgical procedure in India. Right, so that one is within my own reach. Right, I have them, but in some of all these cases, if I receive them, I will try to work hand in hand. Let me see if there's any surgeon, a good surgeon, please, in Nigeria you can try and reach out to me. I want to know you in person, especially if you are doing all this critical surgical procedure, right? Like that of scoliosis, that of lordosis. There are some certain even hip dysplasia, right? All those kind of surgical procedure, right? Because some people may need your help. So instead of referring the person to India, it's actually important you do it in Nigeria, where you save cost and even obtain a healthy life. So but if we didn't see anyone within the country and we see anyone that having the issue, all right, please share this video so that we learn from this, who know this. We have a link, right? We have a link to India for such surgical procedure to be carried out. They'll do it perfectly, and it's going to be something that you come out being more healthy and living your life as expected, all right? So they did do all kind of plastic surgery, right? Modernized surgical procedure. So we have discussed that of congenital scoliosis. Is when what there is problem with the spinal cord of the forehead too. So the thing refused to develop as expected due to maybe it can be a genetic issue. It can be a result of the maternal engagement with alcohol and even smoking. It can be a result of different lifestyles, so even some certain medications. I've mentioned this time without number about teratogenicity. I've mentioned it, all right, or which I say you need to actually seek medical help, all right? That is, you talk with your healthcare provider whenever you want to take medicine, so that you know exactly the one that will be good for you as um as someone that is pregnant, because there's one you will take, it may lead to more challenge when that is to your fetus. It can lead to problem with the development of the fetus. So please let us try to know this. All these things can actually, some of them can actually be prevented, some cannot be prevented, some of them are unknown, some are unknown, but let us just try as much as possible to do something about it, so that we can reduce the occurrence, because it's becoming too common. If you go to social media, you see a lot of defects, what is happening, right? So we need to know them and prevent them. So I think this is where we're going to stop for today. Sorry for streaming at this time. Is network that made us to be in this way, but it's fine. So if you view this video, if you have any question, put it on the comment section. Tomorrow we have a lot of things to discuss also on this channel about other health things, other things that matters to our health. See you guys tomorrow. I remain Health Educator Mike, and this is Healthy Living Global. Always connect with us. This is where you receive vital information for your everyday health need. Thank you.